working as a clinician in inclusion health, I was always struck by how people were often excluded from the system, and then I got involved with a project called GPs at the Deep End, which was a sort of group of GPs who work in the most socioeconomically deprived communities in Scotland. And when we all got together, it really quickly became evident that the sort of issues that we were trying to grapple with as day-to-day clinicians in inclusion health, actually mainstream Deep End practices were doing the same. And that got me thinking. Initially, actually, we went to some funders and said, we want to look at developing some interventions, and the funders basically said, this isn't an issue. So it was invisible at the sort of research and policy level as well. So that really started us on this journey where we then managed to get funding and undertook epidemiological work, looked at over 500,000 patients' records from across lots of different practices in the country. And when we pulled all of that together, we were actually a bit shocked. We thought it wouldn't be great. We thought people would maybe have poor outcomes, but actually people had lots of health conditions. Death outcomes were really high, particularly for people who have mental health diagnoses in their GP records. The important thing though about research is that, it doesn't take place in a vacuum, and we as a team need to be thinking already, how can we be ensuring that policy and practice colleagues hearing about this work are open to thinking about the solutions, and across the team we've got good relationships with our range of colleagues.